Hi dear students, today we'll see how to dissect the pectoral region. We are going to follow Cunningham's manual of practical anatomy, upper limb and lower limb. We'll start with this dissection 5.1, that is skin reflection of front and side of chest. The objectives are, the first one is to reflect the skin on the front and side of the chest. Second, to examine superficial fascia. Third, to find the cutaneous vessels and nerves. First, make the incision, that is 1, 2, 3 and the 4. Make sure to carry the incision 4 backwards as far as the posterior axillary fold. Cut through the superficial fascia in incision 1, 3 and 4. In this diagram, superficial fascia can be seen. Start from the midline incision, that is number 1. Reflect the flap of the skin and the superficial fascia laterally by blunt dissection. Do not detach the skin, reflect them laterally as in this diagram. Leave the nipple and the surrounding skin in position as landmark. As the flap is separated from the skin of the neck along the clavicle, split the superficial fascia with a blunt instrument. Avoid cutting through the thin sheet of muscle, that is platysma, and the supraclavicular nerves. The supraclavicular nerves pass anterior to the clavicle to supply the skin of the upper part of anterior thoracic wall and the shoulder. These are the supraclavicular nerves. Platysma is a muscle, a thin sheet of muscle which is located in the superficial fascia of the pectoral region. It extends up to the base of the mandible. Identify the medial, intermediate and the lateral branches of supraclavicular nerves. Medial, intermediate and the lateral branch of supraclavicular nerves which are passing superficial to the clavicle. In females, note the fibrous band that is connecting the deep fascia to the skin. The fibrous bands here are called as suspensory ligament. That can be seen here as well as in this diagram. Here the breast tissue is being dissected to show the whitish area here, that is the suspensory ligament. Also the fat can be seen. In this diagram, one lobe of the breast parenchyma can be seen. Find the anterior cutaneous nerves and vessels which emerge from the anterior ends of intercostal space. These are the intercostal nerves and this is anterior intercostal nerve. Follow the branches of one of this nerve medially and laterally as far as possible. Find the lateral cutaneous branches which pierce the chest wall almost at the mid-axillary line. So these are the lateral branches and these are the lateral branches. They emerge through deep fascia, one inferior to other in a vertical line. Follow the branches of one of them anteriorly and posteriorly as far as possible.